Hello, and welcome to Beating Heart Disease. My name is Kevin Wells. I am a heart disease survivor. I had a quadruple bypass about a year and a half ago. Today I'm coming to you from the hospital. I was trying a new homeopathic therapy and it didn't quite work out so well, so I'm in the hospital. That's why I always tell folks, to do your own research and make sure these treatments are fine for you. Homeopathic stuff is generally safe, but it can also land you here if you're not really careful in what you're doing. I will make a video about what I actually did to keep you informed. But today I'm just going to talk to you about what you might expect if you have to come to the hospital. Maybe you've been through a bypass and then maybe you're having complications. You have to call 911 and go to the hospital. What will you experience, if you have to go back? Or if it's your first time calling, you have a chest pain or something, what can you expect when that happens? So, first thing is you're going to call 911, I guess. And, of course, they're going to ask you a bunch of questions when they get there. They're going to want to know what your symptoms are, what kind of medications you have taken that day. Maybe if you've taken aspirin, if you called 911, they told me to go ahead and take 4 baby aspirin. I thought that was quite a bit, but here at the hospital, they seemed to think that was the correct thing to do. So it's all good. I mean, I'm still alive and feeling good now, several hours later. So I will, more than likely, 99% chance be released tomorrow with no issues. So just had to have some blood work. They're going to just want to continue blood work tonight. Anyway, while the ambulance is there, paramedics, they're going to put leads on you and they'll do an EKG right there on the spot. They'll ask you to sit still while they do an EKG. They'll take your pulse. They may actually give you an IV, a good line, in your arm that they can take blood from. It'll check for, cardiac enzymes, cardiac proteins, stuff that your heart would give off if you're having a heart attack. Good thing for me, all my blood work looks good. So that's something that you'll get, one of the other things. In the ambulance, they may actually give you nitroglycerin if you are experiencing chest pains or if your blood pressure is extremely high. And then when you get to the hospital, if you haven't already gotten an IV, or even if you have from medical personnel, they may decide to give you another one. Some hospitals do, some hospitals don't. I would highly suggest if the line is good, that you try to convince them to just keep that one, because if you have to go back several times, you start getting scar tissue, and it starts getting harder and harder to draw blood or to have a good line actually put in. So you may want to try to encourage them to save the line if they possibly can, and quit poking you with a bunch of different needles. The paramedics are way better at putting these in than the people at the hospital. I guarantee you, I've had firefighters get them into my hand in 15 seconds. The veins in my hand, that's usually one of the hardest places to get them. And then I've had people at the hospital struggle to get one into the main vein in your arm right here. So there's no excuse for them struggling at the hospital to do that, but I've had it happen quite a few times. So anyway, so you get to the hospital, in the emergency room, they're going to ask you kind of the same questions that the paramedics asked you. They're going to take another EKG, more blood work, pretty much just going to monitor you unless you're having active chest pains. Or if you're actually having a heart attack, then things are going to get a lot more invasive. Let's say they might actually run you immediately to a heart cath. I know some hospitals have a heart cath lab right in their emergency room, so they can take you right into the heart cath and see what's going on in there immediately. It's a very good thing, can save a lot of lives. So, but me, I was just having palpitations, high blood pressure, kind of lightheadedness, that kind of stuff. So it wasn't a heart attack. Not sure what it was, but again, like I said, I'll make a video of what I was trying to do, and at a later date. Anyway, so while you're sitting, at the house, if you have somebody there with you, you may want to have them, while you're waiting for the ambulance, you want to have them get a bag of your supplements and your medications, because they're going to want to know these things, and sometimes it's a lot easier just to have them with you. Also, you may not be able to remember them all. The other thing is you have to stay in the hospital for a few days. They may not even have, or if you have access to some of the supplements that you take. So I've had doctors that never even heard of some of the supplements that I take. So I don't want to just go cold turkey, so I've had to stay in the hospital for more than a day or two. It's good to have those on hand so you're not going cold turkey. Another thing to always have on hand is your toiletry bag. Just toothbrush, your own razor, your own, they have razors and that kind of stuff at the hospital, but trust me, you're going to want your own, because they're a lot better than the ones at the hospital. Glasses, if you have contacts, you need your solution for take your contacts out at night. Glasses, if you wear glasses, you want your glasses case. Phone charger. Phone charger is a major one. I've forgotten that before, and trust me, while you're sitting there waiting in the ER, you're going to burn up the battery on your phone. So once you get a room, you're going to need a charger. So that's a big thing. You may want to change underwear, maybe some sweats. Be comfortable while you're here. So once you have been to ER and they determine that they want to keep you overnight, you'll get moved up to cardiac, where they're monitoring you, and it'll be you'll basically get a different monitor. In ER, you're hooked up to a line monitor where you can't really move around a whole lot. But once you get up to where they just monitor you, you'll get one of these mobile ones so you can walk around. It has a little pocket in here. So this is being remotely monitored in another room. So if you have any problems, they will detect that, and they can come in here and see if there's anything wrong with you. But anyway, that's a little something about how you in this area you can walk around. There'll be people walking around who may have had surgeries and they're in recovery, or there may be people that are like me and just have some symptoms and stuff from the complications and that kind of stuff. But anyway, if you enjoy this video, please subscribe and click the like button if you would like to. And thank you for watching, and I'll see you next time.